Okay, so we're going to do all kinds of things about the skull in 5 minutes. Okay, here we go. We're going to do bones of the skull, the shape of the skull. The first thing I want you to know is this is called the cranium, and these are the facial bones. Okay, there's 8 cranium bones, and then there's like 14 facial bones. We're going to go over them real quick. If we look at these little lines through here, these are called sutures. Where are they? Right here. I'm looking at the screen at the same time as I'm trying to do this, so it's a little difficult. But we have the sutures, and suture, just like sewing up, means that's where it's knit together. This is called the frontal suture. This is called the Bregma. This is your soft spot when you're a little baby that actually closes when you get a little bit older. Okay, this is that little like spot, little soft spot there that little babies have. You press it really hard, it resets them completely after crying. No, don't do that. Don't do that. Don't do that. Up through here, if you see them cry though, it'll pulse because their pressure, like they're screaming and stuff, their pressure will increase, and you can see the pulsing through the top of the skull. This area through here, this is called the sagittal suture, and it comes back here to a thing called the lamda. Lambda is here, Bregma is up here, lambda because it looks like a upside down Y, which is the Greek letter for Y. And we come down here, we have this one here is the occipital suture, and then we have the temporal suture through here. Okay, this is the parietal temporal, temporal parietal suture. Now, there's a bunch of other sutures in here, but we're not going to worry about those. These do follow the bones follow the parts of the brain, which we already went over. Okay, so we have frontal bone is through here. It goes all the way down to the top of the eyes. Okay, and all the way up into the Bregma and this coronal. Remember the corona like. The crown that the Queen of Spain wears was like a corona. It's like the sun, a little around the sun, right? Like if you look at my glasses, you can see the little circles. That's a corona, basically. So frontal bone, parietal bones up through here, temporal bone all through this area over here in the front. Sorry about that. And then in the back, the occipital bone. The occipital bone has a big hole in it in here called the foramen magnum. And these are the condyles that sit right on top of your spine. Let's take this off because I'm going to end up losing it. Unconnect everything. This is just the top of the brain, and we're going to look around to the face. We have the nasal bones in the front. We're doing the real easy ones right here, guys. The nasal bones in the front, this is the maxilla. Okay, maxilla, and then this guy here, one of my other favorite words is called the zygomatic arch right here. The temporal zygomatic joint is right there. Okay, and then what else do we have? There's other bones in through the orbit, which we'll get into at another time. I just wanted to show you these basic ones. Then, of course, we have teeth in through here, and we also have on the bottom, there's a split in through here, which you can't really see. And I'll tell you a secret. If you want to reset some of the way your skull is, take your thumbs like this right behind your canine teeth. Those are your sharp ones there, the canine or eye teeth they're called. Right behind that, put your thumbs in there and push away, and you'll hear your skull go click and crack open. It doesn't crack open. What you're going to do is you move it. It's just like this. Boom. That can help with headaches sometimes, a tension headache and stuff like that. That's going to help there. Other parts of the inside here, we're looking on the inside. Again, there's the foramen magnum. Your brain comes through here. And through here, we see the spinal cord coming up and turning into the brain. We talked about that. It's a brain stem. It's going to be right through here. As we work up into this section here, this, which looks kind of like a butterfly, if you hallucinate a little bit, you have right here a thing called the sella turcica. I don't know if you can see it. Let's see if we can kind of see it. And it looks like what's called a sella turcica, which means a Turkish saddle. So back in the day when armies had cavalries, which were guys on horses, and they had a lance, a big stick to poke each other with, the Turks had saddles that came up really high in the front and high in the back, so they couldn't really fall off as easy. That's why it's called the sella turcica. That's where the pituitary gland, which we talked about in the brain thing, that's the master of the glands, right, sits there. The frontal bone sits through here. Or the frontal lobe, sits through here. This is the temporal lobe, sits through here, and the occipital lobe. And down through here, this section in the bottom, that's where your cerebellum would be. Right back there, okay? Occipital, then we have temporal, and above it, we're going to have parietal, right, and frontal, okay? Basic and easy stuff. Nasal bone right in the middle here. We have the nasal concha, or the cribriform plate is going to be this little guy here, those two little dark spots, I guess. So we have this little plate in there that has little tiny holes in it that the nerves from the brain actually push through and go right up through here. So if you stuck something up there, like a pen, don't do this. Don't do this. Listen, don't do this, okay? If you poke a stick or something up there, you can actually hit that and mess it up. So we don't want to do that. That's where your smellers are. That's how you smell things, is through there, okay? We're having pieces of this fall off and fly around, and that's okay. So basics of the skull. Maxilla. The jaw, this part here is called the mandible. I don't know where it went. I seem to have lost it. So I'll find it somewhere. Teeth, we have different kinds of teeth. We'll talk about those later, but the front ones here, like we're missing one. These are your incisors, and then you have your bicuspids, and then you have tricuspids, and then you have molars in the back, okay? So you're going to have those 32 adult teeth, right? And then in the back here, you'd have the molars, but you're going to have a couple molars. You're going to have some tricuspids, bicuspids, eye teeth or canine teeth, and then you have your, well, these are bicuspids, and then you have your what's it called? Your incisors right in the front. That's these guys here. Matching teeth on the bottom, of course, hopefully, and then you have alignment. The TMJ, or temporal mandibular joint, is going to be right in through there. And this is the EAM, the external auditory meatus. Meatus means whole. Foramen means whole. Meatus means whole. Foramen, meatus, all of those kind of things all mean the same thing. Just depends on the size. Foramen is a bigger hole. That's really what it is. The eye sockets here, surrounded by frontal bone here, nasal bones in the middle, maxilla down on the bottom, and zygomatic on the side. Easy to break this one if you get slugged. Anyway, this is Dr. Sean over at the, where I'm at. That was 6 minutes. Sorry about that. It went too fast. Do your homework. Look at the skull. This is quick and easy. Watch it at half speed, backwards. I don't care, whatever it is. Be good, do good, and we will see you on the flip side. Take care.